Nearly 7 million adults over the age of 65 has Alzheimer's or another form of dementia in the United States. That's according to the Alzheimer's Association. There are also more than 400,000 living in New York State alone. Many of them need caregivers.
The association's latest report is highlighting the significant burden caregivers face. Joining us now to break down the facts and figures is Sarah Harlock and Andrea Cook from the Western New York chapter of the Alzheimer's Association. Thank you both so much for being here this afternoon.
Thank you.
So this is an annual report. What was revealed this year? What are some of the biggest stressors?
So Sarah and I were talking. We've both been at this for a few years now, and we've been noticing that the number of people with the disease has been creeping up year after year. We know that a huge chunk of the population is entering older adulthood, and because of that, we're seeing more and more cases since age is the #1 risk factor for developing this disease.
And so often, when the Alzheimer's Association shows up to talk about the services that they offer people of Western New York, we always, or generally always, focus on the people who have this disease, who have Alzheimer's or have another form of dementia. Not enough attention has been given to caregivers, clearly based on this report, because they are impacted by this on a daily basis. Talk about some of the difficulties that people may not be aware of, particularly if they don't have to deal with this disease directly.
Sure. So, caregiving as the disease progresses can turn into a 24/7 job. There is a huge burden on families, even though in many cases it's a labor of love. That doesn't make it any less exhausting or draining, particularly if there are challenges, or maybe the person they're caring for, maybe they've always had a troubled relationship with that person, but they have to step up now. It's a hard job.
And more than just, the health side and the time side, there's also the financial burden, right? What does that look like?
So there are a lot of costs that go into caregiving for somebody with dementia that are not covered by health insurance or other programs. There are several community-based programs that caregivers can tap into, and whether that's education programs, community social programs, there are grants for adult day programs and things like that. So there are community resources available to patients with dementia or people with dementia and their caregivers. But there are additional costs, and it's really important that people are planning for this well in advance. I talk frequently to caregivers about positioning their finances for future care needs. So, very important.
That is a really good point, I think. And that while we're talking about the finances, what are some tips to do that? Because at what point do you start saving? Because that's a great idea if people have the capability of doing it. Do you have to start saving when people start getting sick, or when you start noticing maybe some of the symptoms?
So to me, it's not even so much about the saving. It is really about sitting down with an elder care attorney or financial planner and being able to talk about, here's our retirement funds, and how do we position this so that we will have more options for care, as opposed to perhaps gifting money or something that then somehow jeopardizes the future ability to pay for resources and care and that sort of thing. So,
as the number of those with the disease keeps going up, and you look at this report annually, what do you as an organization hope comes from these numbers, other than, beyond raising awareness?
Sure. I mean, I think certainly raising awareness is key, but the piece that Sarah was referring to about encouraging people to get a diagnosis earlier, for a number of reasons. A, because of the new treatments that are becoming available that are only effective if a person gets access to them early on in the disease, but also that planning piece that Sarah talked about, getting your affairs in order, the gifting piece. So many folks may not realize that Medicaid, if you apply for Medicaid because you've run out of money, there's a 5-year look-back period, and if they see that you've gifted a family member some funds, they may say you have to repay that before Medicaid can kick in, and there are a lot of pitfalls along the way. So that early preparation is really key to better, smoother outcomes later on.
And the other really important part is with the early detection is making sure that caregivers are getting tapped into resources like the Alzheimer's Association and that they are building their support systems and so on too. So
I'm glad Andrea used a word like pitfalls, because so often we talk about the Alzheimer's Association helping to avoid, or helping people with dementia and Alzheimer's avoid those pitfalls. We're really trying to tell people that we are trying to get caregivers to avoid those pitfalls as well. And the Alzheimer's Association can be a fantastic resource for that as well. Thank you guys so much for being here.
Thank you.
Appreciate it.
All right, let's send it back over to Todd now for another check of the forecast. Todd, how long are we holding on to this winter chill for?
Into the